Thank you all for coming out tonight. My name is Corryn Nelson. I'm a physical therapist here, and with my primary focus being in pelvic health, though I do see some orthopedics and work in our medical rehab department as well with pulmonary fitness and our movement as medicine class. So just a little bit about me. I went to Husson University to get my bachelor's in kinesiology and continued on there to get my doctorate in physical therapy. I was fortunate enough to have some of my clinical experience be in pelvic health, which really solidified my interest in pelvic health and learning more about it. I started out of school at Elliott Hospital for a few years before my husband and I moved to the area and started working here for Monadnock. So to start off, the pelvic floor is a group of muscles and connective tissue at the base of our abdomen. So you can think of it often as a foundation to a house. It helps to support and keep everything in line up above it. So these muscles help to work with your abdomen, your back muscles, other hip muscles and leg muscles, and your diaphragm to help support your spine and control the pressure inside your abdomen. They help with our posture and making sure that as we're moving, we're not exceeding certain limitations in tissues. So the job of our pelvic muscles is to support our internal organs, to help us maintain our continence for our bowels and bladder when we're not in the restroom. They help us with emptying when we are in the restroom, and they help to stabilize our lower back area, our sacroiliac joint or our SI joint, and they help to transfer your weight or load from one leg to the other while we're walking, moving, going up and down the stairs, picking up groceries. It's good that it helps to transfer the energy from one side to the other. So with that being said, we like to kind of keep in the consideration if there's any abdominal scar tissue from surgeries. You know, even though it might not be pelvic floor directly related, it can impact how well you're moving and have a consequence for your pelvic floor muscles. So I've seen patients that have had their gallbladder out, appendix, a C-section scars, prostate surgeries, kind of a wide range of other abdominal surgeries that maybe, hopefully today, if you have further questions, you feel comfortable with talking to your healthcare team and your PCP or other providers. So that way, if it's something that I can help with, I certainly can, get you set up with all the information you need. It helps with circulation, so it kind of acts like a sub pump in our pelvic area to keep our circulation going and help with, any circulation issues in your legs to make it back up to your trunk. And it works with your diaphragm muscle, your breathing muscle to help with that type of an action. And then we also have a sexual function as well, which sometimes can be hard to talk about with patients bringing in questions, but it certainly plays a role in these muscles. And just like other muscles in our body, our shoulder, our leg, they can become too weak or too tight, and that might create some issues for you. So I always tell my patients it doesn't hurt to ask questions, so that way your healthcare team can steer you in the right direction. So pelvic health is, I think, growing in importance. For a while, I think it was hard to discuss just because it has an intimate nature to it, and it's not always easy to talk about certain issues going on. But it can help improve your bladder and your bowel control and help reduce the risk of prolapse. Your pelvic health can be affected with pregnancy, childbirth, or other surgeries, including prostate surgeries for males that can present an issue for the pelvic floor and your urinary tract system. It can improve your sexual function if you have any concerns with that, and then it can also improve your social confidence and your quality of life. I've had many patients share with me that they, whether it's due to pressure or incontinence issues, they feel like they're embarrassed to leave their home, so they start to not go out as much or visit with family members, or at work it can add a little bit of stress. What if I leak here and I don't have an extra pad or something like that? So it can be very self-limiting with these issues that we'll further discuss. So to start off with breathing and circulation, the pelvic floor works with your breathing muscle, your diaphragm, that sits underneath your ribs, and they should ideally move up and down together to help manage the pressure you have in your abdomen. We don't want an accordion effect where things are being compressed and then vacuumed, because that can create either leakage issues or prolapse issues. We might have a hernia result from that repetitive pressure. So this can affect both genders. And there's actually some really neat research coming out now about diaphragmatic breathing and all the effects that it can have. So just to name a few, it can help to lower your heart rate and your blood pressure, can decrease muscle tension, and decrease the levels of your stress hormones. It can help with increasing your energy and in your movement comfort and motivation. Again, kind of tapping into some of that social confidence. So this can be a technique that we can go over. It helps to regulate your nervous system. So we have two sides to our nervous system, one that controls more of that get up and go or fight or flight response, and then we have our rest and digest side. I think our typical day-to-day activities definitely favor more of that get up and go. We don't always maybe listen to our body or get enough sleep, quality sleep. Things like nutrition can also affect the rest and digest side. So the breathing exercise here can help with restoring a little bit more of that rest and digest, and create a better balance between the two. And then it can help with reducing any bloating, abdominal pain, urgency for both bowels and bladder, and constipation issues. When we do a belly breath or a diaphragmatic breath and you really have that diaphragm dropping down, it can act kind of like a massage in a way to your internal organs, your intestines, and that can help to stimulate them to keep moving in the right direction. So it can be very helpful for regulating your bowels, creating more of a consistency, and it can help with making sure that the other muscles in your core container are working together. Then we have a couple different types of incontinence, and this again is true for both males and females. Probably the most common is our stress or urge incontinence. With stress incontinence, it's due to some type of pressure from the outside pressing down on the bladder, and if the pelvic muscles aren't quite strong enough or communicating with your bladder muscle, it might result in some leakage coming out. So this would be things like coughing, sneezing, laughing, jumping up and down on the trampoline is a common one. Going down the stairs can be another big factor for people. And then we have the urge incontinence, which is when the bladder is filling up to a certain point. We normally get a contraction that tells our brain, hey, we need to go to the restroom, or kind of start to think about making our way there. Normally that first urge comes when it's about 40 to 50% full, so it shouldn't be a panic type of a situation. But sometimes that bladder contraction can be quite strong. So if our pelvic muscles aren't able to contract to overpower the bladder, we might have some leakage with the urgency to go. And then I know just from discussing with patients a lot, when we have that urgency and we're afraid we're going to leak, we tend to rush to get to the restroom. So we'll talk a lot about trying to stop in place if you can, and you can do a couple pelvic contractions to delay the urge, so that way you maintain control while you walk to the restroom versus rushing once you feel that urge. We have overflow continence, so sometimes we can get into a pattern of ignoring the urge to go to the restroom, and that can cause the bladder lining to become less sensitive to the stretch of the urine that's in there. Over time, it will kind of hit its limit of how much urine it can hold, and we might end up with some leakage when you're moving or getting out of a car, different daily tasks like that. And then lastly, we have our neurogenic incontinence, which is due to some type of disturbance in the communication between our brain and the bladder, or the brain and the pelvic muscles. So this could be from a traumatic brain injury, a spinal cord injury, even having MS or some type of neurodiagnosis like that can affect the brain or spinal cord, can result in some type of neurogenic incontinence. But there are different techniques we can go over and help people with, so that way, even if there's something going on with that communication, they can still empty properly or try to hold when they're not in the restroom. So some of the more popular things I discuss with my patients about controlling the urinary leakage is knowing your irritants. Now, I always say no two bladders are the same. Some people, I find that they can drink a whole cup of coffee and be perfectly fine. They won't have any urinary issues. Some people feel like they might drink half a cup or a cup, and they're running to the bathroom every 15 minutes, half an hour. The more common ones, coffee tends to be at the top of the list because it can have caffeine. But it's also fairly acidic. So even sometimes with decaf coffee, it can be a bladder irritant, and your bladder is going to want to expel whatever's there. So it might cause some leakage or urgency concerns. Carbonation, so your carbonated waters or sodas, things like that, can also be fairly acidic. So it might cause you to go a little bit more often or have some concerns with urinary leakage. Alcohol is another one that is going to cause our bladder to fill up a little bit more, so we'll see that frequency concern come in. But sometimes even acidic foods, like your tomato-based products, can affect you and cause some more frequency or that urge to go. I'm not typically one that says, we have to get rid of all of the coffee, because I don't think that that's very realistic or that people will follow that in the long run. But if you can, try to limit what you find bothers your system, and then you can always drink some plain water around that time, whether it's the morning coffee or a spicier or acidic food for lunch, to help dilute it in your system, and that often helps with controlling urgency and frequency. We try to avoid the just-in-case voiding. I find that this sometimes is a habit we learned as like a younger child. Go to the bathroom before we leave for the store or before we get in the car or leave the house. And we can actually train the bladder to give you that signal to go, even if there's just a little bit of urine in there. So if you can, try not to do that. Again, we can talk about different urge control techniques that can help with maintaining control. If you're out in the grocery store and you don't want to use the public restroom, can you make it home? Limiting fluids 2 hours before bed can be helpful if you find yourself waking up fairly frequently throughout the night. When we're horizontal and laying down, that gets all of our body in the same playing field, so our bladder tends to fill a little bit faster. And if we're drinking up until bedtime, then we might increase our chances of waking up and not getting a restful sleep. I know sometimes this can be tricky if you're taking medications before bed. I always encourage my patients to talk with their doctor and see, can they move it up in the day, or kind of play around with the timing of it, but definitely consult your doctor, whoever prescribed the medication, if it needs to be taken at nighttime. Smoking cessation could be another huge help to controlling any urinary concerns. Your bladder can be affected by the smoking and the presence of nicotine, so it tends to increase our frequency and can irritate the bladder lining, so that might cause some urine leakage. We have a great smoking cessation team here, so if you have further questions, don't hesitate to ask your provider for some help and steer you in the right direction. Managing constipation can also be very helpful. There's only so much space in our pelvic floor, so when there's any stool in the very end of the rectum, it's going to compete for space in that area, and a solid will most likely win over a liquid, and it might end up pushing on the bladder and causing some urine to come out when you're not ready for it. Staying hydrated can be very helpful. Ideally, we should be consuming about 6 to 8 cups of fluid per day, with most of that being plain water. Again, sometimes we can drink the plain water around those other irritants, so that way it's not causing the concentration in your bladder to become too high. The lining of the bladder is very sensitive to a change in your pH, so sometimes I'll have patients that will come in and they tell me, well, if I don't drink anything, then I won't leak or I won't have to go to the restroom. But our kidneys are always filtering our blood, so they're always going to be pushing some of that fluid off to our bladder. And if we're not drinking enough, then the concentration of urine in our bladder can be very high, even without the presence of coffee or an acidic tea or something like that. So we definitely want to stay hydrated. Just because we're not drinking doesn't mean we're not going to have certain issues. And then trying not to hold your bladder too long. Again, we can overstretch that bladder lining and make it less sensitive to the presence of urine in there. The typical bladder should be able to hold about 2 to 4 hours, but we see fluctuations in that depending on what you're eating and drinking. Keeping your muscles strong, which is kind of the primary component of physical therapy, can be helpful. I find that this area is kind of out of sight, out of mind. At least I haven't met too many people that say they practice Kegels in the gym or something like that. But it is something that we go over just to make sure you're doing correctly. And in your folders today, there is a sheet of different stretches and exercises. The Kegel exercise is included in that, and it has a nice written description to make sure you're doing it correctly. I always say if you're in the grocery store, you should be able to try to do a Kegel, and no one around you should be able to see. So if you see your shoulders rising, or you're holding your breath, you're squeezing your legs together, those are some of the more common compensations that I see with different patients with trying to activate and isolate your pelvic floor muscles. So it should just be, trying to stop the flow of urine, or holding back gas is another common kind of mental image that we'll use to train the correct muscles. And then trying not to go and rush when you're in the restroom. I think this is probably more common for my newer moms, where they think if they can just kind of power through and might strain to empty their bowels or their bladder, they'll get out quicker and get back to whatever they're doing. But whenever we're rushing or straining, we're not going to be relaxing our pelvic muscles as much, so we won't empty all the way, or maybe we'll have some leakage when we stand up from the toilet. If you take 5 to 30 extra seconds, it's not going to probably make that much of a difference to get out of the restroom, but you'll get a better relaxation and a better empty. So we have fecal incontinence or constipation can be another large concern for the pelvic area. And there's kind of a wide range as to what's normal for bowel movements. Some people, they can go up to 3 times a day, and that's perfectly fine. And some people, they might go once every 3 days. Now, if we're really pushing that 4, 5, 6th day and there's really nothing moving, then we want to try to promote some motility in your gut, maybe increase some physical activity to try to help promote that movement. And then staying hydrated is another big one. So that 6 to 8 cups with at least 75% of it consisting of plain water is ideal. I know sometimes people aren't super keen on plain water, so maybe looking into if you can put cucumbers or strawberries or some other type of flavoring to make it a little bit more enjoyable can be helpful. And making sure that we have enough fiber intake is another big key factor. Ideally, most resources will recommend somewhere between 25 to 30, I've even seen 35 grams mentioned for your consumption. Ideally from food, whole foods versus supplements, but sometimes we just need a little bit extra. Now with this, I will caution, don't run out today and start buying the supplements and taking them right off the bat. It's good to kind of wean yourself into it, because our system doesn't really like fast or sudden changes, and it might end up resulting in some gas or bloating. Some people will get some cramping in their abdomen if that fiber intake is too fast, too quick. So kind of slow over the span of a couple weeks, you can look into consuming more vegetables or fruits that are higher in fiber, or if you do take a supplement or powder, psyllium husk, you can kind of slowly increase it. Don't just jump to whatever it says on the bottle. Everyone's system is a little bit different, and I always say we can add, but we can't take away once we've done something. Okay. Try not to hover over the toilet is another big one. If we're hovering or squatting over, we're not going to be relaxing our pelvic muscles enough, and that might create more of a constipation issue, because now that stool has a harder time with coming out. And again, we don't want to rush or strain or hold your breath for a bowel movement. So we will go over bowel techniques in physical therapy to try to help with reducing any type of strain. It's really common, I think, especially with constipation, if your stools are hard, that we tend to hold our breath and bear down. Not great for the pelvic floor. When we hold our breath and try to push at the same time, we actually tighten these muscles. So you're essentially shutting the door as you're trying to get something out, and it won't end up with a complete empty, or we might get hemorrhoids or things like that. Prolapse issues can be a concern with constant straining. And then we don't want to ignore the urge to go for our bowels. The longer a stool sits in our large intestine, the more water we are absorbing from it. So it can make that stool more compact, which can be harder to get out. And then with physical activity, we want to make sure that we have some type of movement throughout our day that can help encourage the intestinal lining to keep doing its job and to keep moving. And so different types of pelvic organ prolapses, and though some of these are specific for females, we can have prolapses with males as well. But we can have our uterine or cervical region drop down into the vaginal canal. We can have a cystocele, which is when your bladder starts to press back into the front wall of the vaginal area. And then the rectocele is the rectum pushing from the back into the backside of the vaginal wall. And I would say less commonly, we see the enterocele is part of the small intestine coming down into the vaginal canal. And then we have the rectal prolapse, which is when part of the rectum can either drop down or protrude out of the anal area. So it can be kind of alarming when if you're in the shower or after going to the restroom that you've noticed something protruding, or if you just notice a heaviness, pressure, discomfort in your pelvic area. It could possibly be that there's a prolapse that's dropped down. But physical therapy can be something that can help with strengthening, but there's other options, and you can discuss with your PCP or your gynecologist, your GI specialist, and they might kind of work together to help develop a plan specific for you. So to prevent or manage a prolapse, we want to avoid straining on the toilet. So there's kind of a couple of repetitive themes coming up with a lot of these different conditions. You want to breathe when you exercise. I often joke with my patients that I'm going to get markers, and there's a big mirror in the pelvic room downstairs. I'm going to write "just breathe" on it, because so many people, when we're doing core exercises or leg exercises that are challenging, we want to hold our breath. But if we're holding our breath, that pressure often drops down towards the pelvic area. Fortunately for females, we have 3 openings, so it's kind of a weak spot inherently. And then we want to avoid lifting heavier than what you're capable. So if you have a heavy case of water or a big bag of dog food, cat litter, things like that, sometimes you can ask the cashier at the store to help bring it out to your car, or at least move it into your car. If you have someone at home that can help you with moving that stuff, it certainly would save some stress in your abdomen area. But we can work on lifting mechanics and trying to make your muscles stronger, your legs stronger, core stronger, to try to prevent that extra strain going down on your organs and pushing them towards that pelvic floor. And then certainly ask your healthcare provider questions. I know a lot of times our OB department will work with patients for what's called a pessary. It's a type of device that can be inserted into the vaginal area that helps to support a prolapse if it is protruding from the vaginal area. And it can often work really great with trying to strengthen the pelvic muscles. There's other over-the-counter products as well. I know Poise makes what's called a Poise Impreza. A lot of my newer moms, if they want to return to running, it's kind of like a tampon type applicator where it presses against the urethra, and it can help control any incontinence or leakage issues with running or exercise until those muscles are strong enough to control it on its own. And then we want to maintain a healthy weight. Sometimes an increased BMI can increase the likelihood of developing a prolapse. It's just more pressure down on the pelvic area. So that pushes it and strains the ligaments that hold up your organs. So another big section for pelvic floor PT is pre and postpartum. So I would say the biggest thing, if I had to choose one, is to really watch your posture. It's very easy as pregnancy progresses. Your weight tends to shift more towards the front side. So we tend to see this first image here where we get an increase in your lower back curve. Your shoulders tend to round forward. We might kind of extend or hyperextend our knees because it's easy to stand like that, but not great for your joint health. So we'll work on core strength, activating your glutes a little bit, which tend to get shut off with the changes through pregnancy, and working on just general postural strength, which can help your pelvic floor do its job. We want to stay hydrated. Sometimes with pregnancy, there's just a limited room in your pelvic area, so an increase in frequency of urination is expected, but we can talk about different things to try to make it so it's more convenient for you, but we want to make sure we stay hydrated. Eating, again, a balanced diet of fiber and keeping your bowel movements the right consistency can be very helpful throughout pregnancy, so that way you're not having that extra strain. And then knowing your limits. So, if there's something coming up at your house and you're gonna clean the whole house, try to break it down, maybe do the kitchen one day, the living room in the other, and break it up like that, just so that way you can give your body the rest it needs and you're not pressing well past the limits just because you have to get something done. And then to try to maintain your strength. Fatigue can be a pretty big challenge for the pre and postpartum patient. I think it's important to recognize when you're kind of at your limit and rest, so that way you're not exceeding the tissue limits and causing some back pain or shoulder pain. Neck pain is another common one, but your pelvic floor as well. It's handling a little bit more stress and load because of the pregnancy, so we want to make sure that we're not compromising those muscles because of the changes that your body's going through and what you're trying to do throughout the day. So we do focus a lot on body positioning and body mechanics to help with that. And then we have menopause. So this is, I think, more of an up-and-coming research topic because we do spend quite a large portion of our time in menopause, about roughly to 40%. And there's a lot of changes that can happen just because of the loss of estrogen, and it doesn't necessarily only include the pelvic area. But it is fairly common where we get some vaginal dryness. We'll see some changes in sleep and your metabolism. We're more prone to having muscle atrophy. We see a decrease in bone density, so we really want to make sure that your weight-bearing status and your exercise status is still going on with menopause and post-menopause. And then there's a possible weakening of the ligaments that support your pelvic organs and your pelvic muscles. So we often see an increase in pelvic organ prolapses just because of this change. And it doesn't necessarily involve a change in activity. It's just a change in hormones that can have an effect. And then more specifically for males, probably the most common thing I see are issues involving the prostate or after a prostatectomy, where they're going in and they're cutting out actually a portion of the urethral canal, and they kind of bring that bladder head down to meet the rest of the urethra. So it can result in some pain with urination or difficulty with continence status, leakage with coughing, sneezing, moving is another big one. But males can also have, very similar to females, the frequent need to urinate, a slow or intermittent stream. Sometimes with prostatitis, which is this picture here, when that prostate gets inflamed, because that urethra is going through it, it's going to kind of act like a little bit of a kink in a hose. So people feel like they have to go to the restroom, but when they're going, either nothing happens or it takes a long time to start your urine stream. And doing that belly breath can help with this and help relax your pelvic muscles. Can create a little bit of a passive pressure on your bladder to help it empty. But there's other toilet positionings and postures that we can try, so that way you don't feel like you're running back to the restroom every 15 minutes because you didn't empty well in the first place. And though while some changes can be expected with aging, we certainly don't want them to limit your daily function or your quality of life. So if you have a partner or know somebody that has shared with you certain concerns, then please encourage them to speak with their providers, because we don't know if something's going on unless you share that with us. And then back versus pelvic pain. So sometimes it's kind of a chicken and an egg scenario, but with Our back and our pelvic area, we can have difficulty with walking, and that can favor certain muscle groups, which can create more overuse in certain areas versus others. We tend to be a little bit tighter throughout the front of our hips versus our glutes in the back. So it creates a little bit of an imbalance, and that might cause some lower back pain. It can kind of migrate up the spine a little bit. We might see some knee concerns or knee issues, hip issues. And then sometimes with, more so with pregnancy, but it doesn't always have to be, we can have pain with weight bearing on one leg. So walking, climbing, getting dressed, in and out of the car can be another big one where you're having a separation of your legs. Whether it's because of tight muscles around the area in your pelvic floor, in your legs, or back muscles going down. So that's something we can work to address and become more flexible. And then sometimes we can have nerves or nerve roots be irritated further up the chain, which can have an increased muscle tension effect and irritability around your pelvis or your hips. So with sitting, we often see a decrease in blood flow to this area, which can make those nerves a little bit more irritated, and we might feel pain or tension that might limit our activity or kind of slow us down a little bit. And then certainly with a trauma, a fall on a tailbone or your knee, a lifting injury can affect your pelvic muscles and your hip muscles. So kind of looking at the whole picture, making sure that all of the muscles and the tissues from your core, pelvic, legs, they're all working together, can help with just your general comfort in doing your day-to-day activities. And so in summary here, there's a couple of different areas that your pelvis plays a role in, and that pelvic rehab can certainly help. So we can help prevent and manage pelvic organ prolapses. It can help with breathing and circulation concerns, bowel and bladder concerns, certainly pelvic pain, pregnancy, and sexual function. So I hope that today, if you have any questions or if any of these topics are kind of hitting home with you, that you feel comfortable enough to speak with your provider and ask questions, and they can steer you in the right direction. But sometimes that first step of asking a question can be the hardest. Okay. So in your sheets or in your folders here, there are some general kind of tips and tricks for controlling your bladder health. Some of the stuff is what we went over on the slides, but it can be helpful to kind of just reference for home. And there's information about your bowel and gastrointestinal health. And then lastly, we have the exercise sheet here. So a couple of the more common stretches and exercises that I'll go over with people, or that you can try on your own, just to make sure that your posture can be maximized, that your hip mobility and pelvic mobility can be improved, and your strength. So we have, if you're familiar with yoga, we have the cat-cow stretch. So if you're on all fours, you can arch your back up towards the ceiling and tuck your tailbone underneath you, and then you can do the opposite, where your belly will come down and arch towards the floor. We have an inner kind of groin stretch, where if you can lay down, you can do this. You can do this sitting up as well in bed, where you're having your knees fall apart from one another, and you should feel a stretch along your inner thigh. Then we have our pelvic floor stretch, which is often referenced as the happy baby stretch. You can either hold your knees or hold behind your legs, and laying on your back, you can have your knees a little bit separate from one another. You can do some diaphragmatic breaths in this position to really encourage your pelvic muscles to relax and work together with some of your abdominal muscles. And then we have a couple for strengthening. So the first one is called a bridge. You're going to be laying down, and if you're someone that gets cramps in your hamstrings, then I would recommend trying to pick up your toes as you lift your bottom up from the bed surface. That can be quite helpful, make it more comfortable. We often tend to overutilize our hamstrings, and that's why we get a cramp there. So with picking up our toes, it shifts the use more towards your glutes, and that'll help make it more comfortable. And then we have the clamshell, so laying on your side, if you bend up your knees a little bit, you're going to try to rotate and open that top leg up towards the ceiling, and that'll help hit some of the deeper glute muscles that blend in and help out your pelvic floor function. On the back side, we have the Kegel exercise, which in some cases this is relevant. Sometimes if there's a lot of pain involved or if you feel like you're really tight in this area, you might not want to jump to this one right away. I would start with the breathing exercises and the stretches first, so that way you're not over tensioning the pelvic floor. They should never be painful, but you can often imagine lifting up like an elevator or trying to hold back gas or urine, and you should feel the muscles or the area in the vaginal area or anal area contract and lift into your body. You shouldn't see your shoulders rising or your chest really moving up and down too much. You shouldn't see or feel your legs squeezing together. If you're sitting and doing them, sometimes it's a giveaway. If you're squeezing your glutes, you'll feel your body move up and down. So we really want to make sure that everything from the outside is quiet and we're just contracting our pelvic muscles. And then lastly, the diaphragmatic breathing or belly breathing can be quite helpful for a lot of different conditions. If anything, you can try it before bed. It can help with calming down your nervous system and preparing for a more quality sleep. Okay. Alrighty. A few resources here if you're looking for more detailed information. And then if anybody has any questions, I'd be happy to answer.
I've seen some a stool to help people that have constipation. I was wondering if that's actually working. But so it would raise your legs up or your knees up.
Certainly. That is something that we discuss quite a bit with any type of constipation or movement type issues. Having a little stool can be quite helpful. It actually straightens out the very end of your rectum to make it more of an open angle versus an acute, which can help with emptying. If you've seen the commercials for the Squatty Potty, they're quite funny, but there's actually some truth behind it that it can help. So even if you have a small stool, you can just have your legs go a little bit wider than what you would normally, and that can help kind of mimic the squatting position. Thinking back before we had toilets, we would squat over a hole, and that can help with getting your pelvic floor to relax and to expel the stool. So definitely a valid tool that we discuss. Any other? Yeah.
If the bladder is stretched, is that recoverable, or is that?
To a certain extent, yes. As we age, we do see a decrease in the flexibility of our tissues, bladder included, but we can work on a bladder regimen where, let's say every 3 hours, you would go to the bathroom. This is kind of the one exception with not peeing for the urge, but we want to retrain that bladder to give you that signal when there's 40 to 50% urine in there. So it certainly can be improved with a bladder training schedule.
And another question
Yeah.
is just about the caffeine. I have a son who's 35 and he drinks a lot of coffee in the morning, and I mean he doesn't have any problems with it, with urinating frequently or anything, but is that setting him up for problems? In other words, before you are these modifications that we use after we have a problem, or is it wiser to start before?
I think it wouldn't be a bad idea to start, depending on how much coffee he's drinking. Is it really because he needs it to stay awake, or is there something else?
He just likes it, and
Okay.
he'll drink maybe 3 or 4 cups in a row, though,
Yeah.
So he drinks a lot of water during the day, but at the beginning it's
Yeah. Yeah, and so when we are younger, sometimes that flexibility in our bladder, it might not affect us as much, but it's a little hard to say as he gets older. Maybe he might have more of an issue. I'm glad to hear that he's drinking a lot of water throughout the day, because that can help combat the caffeine and the acidity. And some people, they're just not as affected as others with certain beverages.
Not necessarily something he needs to address.
Right, yeah, I wouldn't probably be too concerned with that if he starts to notice a pattern or having certain issues after. With most people will drink coffee in the morning, and it's that early morning that they feel like they're having difficulty with getting ready for the day or whatnot, because they're constantly going back and revisiting the restroom. Then that would be more of an addressed issue. But no problem. All right. Yeah.
Is it common to have, like, look at the types of incontinence, have a combination of symptoms?
You can have mixed urinary incontinence. Most often it can be the urge and the stress, but you can also have overflow and a couple other types. Mm-hmm. So depending on kind of what type of symptoms you're having, we can kind of develop a more specific plan with what you're experiencing to try to improve the type of incontinence. Any other questions? Alrighty. Well, I hope today that you guys feel a little bit more comfortable with talking about this area. And if these are some things or concerns that you're experiencing, please don't hesitate to talk to your healthcare providers so we can help you. Awesome. Thank you.